this video, we are going to talk about some laws that govern our practice as a nurse practitioner. Let's get started. So, we're going to be covering laws that govern nurse practitioner scope and practice. So, this is going to include federal, like Medicare and Medicaid, state, like our Nurse Practice Act and collaborative agreements, our certification, licensure, and credentialing, and of course, malpractice. So, as far as federal legislation goes, we had the Social Security Amendments of 1965. Now, this legislation was signed by President Lyndon B. Johnson and resulted in the creation of two programs, Medicare and Medicaid, which provide health insurance to older adults and vulnerable populations that would otherwise be unable to access or afford health care. So, Medicare is federally funded health insurance program for adults over the age of 65, people with disabilities, and individuals with end-stage kidney disease or permanent disabilities. And it is divided into four parts covering different aspects of healthcare. So, Part A covers hospitalization, skilled nursing facility care, hospice, and home health care. Part B covers outpatient care, preventative care, doctor's visits, durable medical equipment, and certain home health services. Part C is also known as the Medicare Advantage program, and this includes all of the supplemental stuff. So it includes Part A and B, plus prescription drug, vision, hearing, dental, and wellness program coverage. And then Part D is prescription drug coverage only. Now, each part varies in monthly premium amounts, which is determined by income, deductibles, and coinsurance. Eligible individuals can choose to enroll in any combination of parts or opt to enroll in a Medicare Advantage plan that combines the benefits into one plan. Then we have Medicaid, and this is jointly funded by both federal and state government health insurance programs for individuals and families with low income. Now, it's structured off broad federal guidelines, but each state or territory establishes their own eligibility standards, benefits, and provider reimbursement policies. Therefore, Medicaid can differ drastically from state to state. WIC, or Women, Infants, and Children, is a program offered under Medicaid, and it's tailored to this vulnerable population that benefits from additional support. And also, we have CHIP, or the Children's Health Insurance Program, which ensures children and families that earn too much for Medicaid can still be insured. Next up, we have the Centers for Medicare and Medicaid Services, or CMS. Now, CMS is a federal agency within the U.S. Department of Health and Human Services that provides health coverage to more than 160 million Americans through Medicare, Medicaid, CHIP, and the health insurance marketplace. National Plan and Provider Enumeration System, or the NPPES, is a system used by CMS to assign unique identification numbers to healthcare providers and organizations called the National Provider Identifier, or the NPI. So, what is an NPI number? Well, the NPI provides a standardized identification number that can be used across all health plans to streamline billing and claims processes, facilitating administrative workflow. The NPI is an administrative standard established by HIPAA, right, which was that federal law passed in 1996 that required creation of national standards to protect the privacy of sensitive health information and to uniquely identify healthcare providers. Legislation under the Balanced Budget Act of 1997 allows all NPs to bill Medicare directly at 85% reimbursement under their own NPI. Prior to this, NPs could only bill directly for services delivered at select locations like rural areas and nursing homes. Affordable Care Act of 2010, or the ACA, expanded mental health and substance use disorder benefits and parity protections, mandating that these services be included as essential health benefits in individual and small group plans. This act also expanded Medicaid, increasing access to mental health services for low income individuals. So, in summary, I know I just said a lot. You enroll with NPPES to obtain an NPI number, which is required by CMS to bill for services directly to Medicare, Medicaid, and even private insurance plans. So, next up, what is a DEA license number? Well, a DEA license number is assigned to a healthcare provider by the United States Drug Enforcement Administration, or DEA, and this allows you to write prescriptions for controlled substances. A controlled substance is a drug or chemical whose use, manufacturer, or possession is regulated by the government, so Schedule Class 1 through 5. And certain states may also require you to obtain a Controlled Dangerous Substance, or CDS, certificate in addition to a DEA license in order to prescribe controlled substances. So, why does this all matter? Expansion of CMS really creates opportunities for us as NPs in more areas, especially in those underserved or those areas with vulnerable populations. And really, regulatory standards impact the quality, the equity, and efficiency of healthcare delivery. And these standard guidelines set forth by CMS requirements, they really help us look at safety, health outcomes, and documentation. And all of this, right, affects reimbursement rates for healthcare centers and nurse practitioners. Unique identifiers like our NPI and DEA numbers are crucial in order to practice independently. And these specific identifiers enhance security, accountability, and authentication. Professional organizations such as the AANP continue to advocate for nurse practitioners by lobbying for autonomy, independent practice, and full reimbursement for their services. All right, now let's look at the state level and look at some state legislation. So we have the State Nurse Practice Act. Each state has their own Nurse Practice Act, which is a crucial piece of legislation, and this is what defines your scope of practice or what you are legally allowed to do as an NP in your state. So, Nurse Practice Act defines your scope of practice, and then the State Board of Nursing is the enforcer of your state's Nurse Practice Act. So, it's the Board of Nursing that is making sure that you are following the set of rules. Next, we have collaborative agreements. And collaborative agreements are formal agreements that some states require nurse practitioners to have with physicians, dentists, or DOs, but not with chiropractors. These agreements outline the terms of your collaboration, essentially detailing what your role is and how you'll work within the scope of your practice. It's important to note that not all states require these agreements, because in some places, NPs can practice independently without needing a formal collaborative agreement. So, understanding whether your state requires this is absolutely crucial for your practice setup and being compliant. So, we have all these words, right? We have our license, we have our certification, we have to get credentialed. So, what is the difference here? Well, your license is your ticket to practice and it's issued by each state. Now, each state has its own rules and requirements. So, think a degree from an accredited program, a number of supervised clinical hours, an existing RN license. And there is no current compact license for APRNs like there is for your RN license. So, APRNs need a separate license for each state in which they want to work. And then we have our certification. And while our certification is related to the license, it is not the same. The certification is obtained through your board exam that you are studying for, and it can be issued by either the ANCC or the AANP. And certification proves your expertise in a specific area of practice, and it is a prerequisite in almost every state for getting your license. And then last up, we have credentialing. Now, credentialing is essentially just a big, detailed verification process that allows you to bill Medicare, Medicaid, or private insurance. It's a thorough review of your qualifications and background involving a lot of paperwork. Brace yourself, it can take a while. It can literally take months when you land that first job. Now, this process is usually done by a healthcare organization, clinic, or insurance agency. We will discuss the Joint Commission in more detail under healthcare systems, But it is important to note that this organization works very closely with states to accredit and certify healthcare organizations to ensure that they meet specific standards of care and safety. And that is including that nurse practitioners within the organization are credentialed and that their performance is periodically reevaluated by their peers. Accreditation by the Joint Commission is recognized by a majority of states as a condition required for licensure in order for healthcare organizations to receive reimbursement from Medicare and Medicaid. And then we have to talk about malpractice. So, medical malpractice, this is a form of negligence that applies to healthcare professionals where reasonably avoidable harm occurs to a patient due to a lack of providing the standard of care that a competent healthcare professional would provide in a similar circumstance. Now, malpractice claims may be handled at the federal or state level depending on jurisdiction, and laws vary on what counts as negligence. In general, though, to prove malpractice, the plaintiff or the person filing the complaint must show harm or suffering to the patient by an adverse event, that the provider caused the adverse event, and that the provider was negligent, taking less care than that which is usually practiced by other members of the profession that are in good standing under similar circumstances. So let's look at an example of malpractice. Let's say we have a patient with a history of major depressive disorder and they are under the care of a PMHNP. So the NP decides to change the patient's medication regimen without thoroughly reviewing the patient's medical history, allergies, and current medication list. The new prescription includes a high dose SSRI without considering the potential interactions with other medications that the patient's already taking. And now the patient begins experiencing signs and symptoms, including increased anxiety, agitation, twitching, elevated blood pressure, and palpitations, which, ding, 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 all of these are concerning for serotonin syndrome. Now, the patient, let's say, notifies the office many times to report these symptoms, and the NP dismisses these as normal side effects of just adjusting the medication and doesn't do any further evaluation or monitoring. We know serotonin can be a medical emergency, so let's say that the patient is hospitalized and suffers long term complications as a result of delayed treatment and proper management. In this scenario, the PMHNP may be found liable for malpractice because they neglected to review the patient's history, failed to recognize the onset of serotonin syndrome, and did not provide adequate follow up and evaluation for the patient's reported side effects, which resulted in harm. So, speaking of malpractice, we have liability insurance. And while liability insurance is not mandated by every state, the AANP strongly encourages NPs to obtain liability insurance to protect themselves from financial costs of negligence or incompetence, which are incurred by costs related to liability and legal defense. There are two types of malpractice insurance that are available. We have claims based and occurrence based. So, claims based insurance covers you only while you're employed at a specific job. So, if you leave that job, coverage stops. And an interesting twist, if a claim is made after you've left, say a year later, you won't be covered for incidents during your employment unless you've got what's called tail coverage. So think of it like an insurance safety net that you'll need to purchase if you switch jobs. On the other hand, we have occurrence based insurance, and this one's more straightforward. It covers any incident that occurred while your policy was active, regardless of when the claim is filed. Changed jobs, retired, no problem. If the incident happened while you were insured, you're covered. All right, everyone, that finishes up this video, and I will see you in our next one.